Hey guys, welcome to my channel Praveen Daruvuri. For more medical content, follow this channel, subscribe so you'll get the notifications every time I upload the video. Okay, so today in this video I wanted to discuss about the basic ABCs of medicine, which is also related to emergency medicine. For this explanation I want to imagine a scenario. So imagine you're on a street walking and there's someone who suddenly collapsed, or some accident has happened, or some building has collapsed, and you see a victim lying in front of you. And so what you need to do, first of all, you need to check your safety first. See there's no harm to you, to surroundings, so you don't want two patients here. One patient is enough. If there's some harm to you, you call the ambulance and you stay out of the sight. But if there's no harm to you, you can go near the patient, check his airways. A is for airways. And before you check the airways, you see if he's responding to your voice, if he's conscious, if he can open his eyes and see you and he can talk. Then there is no need for CPR or any other stuff, because he is a conscious patient. He can see but he cannot respond. That's a different scenario altogether. But this one, in the ABCs, I want to talk about this scenario where you see him and he's not responding to your voice command, or you're pinching him, then no response, you're calling him, no response. So what you do is, so this is an unconscious patient, right? And so you check the airways first. If something is obstructing his airways, you do it this way. And after you check the airways, the next part in ABCs is airways is done. You checked, everything is clear. Now B is for breathing. Check, you put your ear near his airway to see if his breathing is normal, if he's breathing okay or not breathing. If the breathing is absent or is low, and then you check for the circulation. C is for circulation or the heart activity. So you check the radial pulse or carotid artery pulse near neck. If both of them are not giving you anything, then you can put your ear on his heart position to check and see if there is heart activity. But carotid pulse is preferred to see if the heart is functioning normally. So if there is no heart function, didn't hear any pulse, the breathing is also like, it's not so good. So what do you need to do now? You start a technique called CPR, cardiac pulmonary resuscitation. So in CPR for adults, here I'm talking about an adult patient, you do 30 chest compressions and 2 rescue breaths. And how do you do compression is very important, because I see many of them doing in various wrong ways as possible. So put your 2 fingers like this, and then put your other hand fingers like this in this position, and this part should be on the patient's chest, exactly shown here. And then you start the resuscitation. And while resuscitating, you don't need to move your whole body, just the hand movement from here to here is enough. So you just do the resuscitation study and then do the 2 rescue breaths. Meanwhile, as I told earlier, you'll be calling ambulance or medical help. They'll be arriving soon, or you have a person nearby, you tell him to continue CPR. So you call and track the activity of where the medical help status is. So when the medical help arrives, they will have defibrillators and other stuff to resuscitate the patient. But you shouldn't stop CPR, because this can save the patient's life in the emergency situations. So these are the basic ABCs of medicine, which are very important in emergency situations. So I hope you liked it and it was informative. And if you want me to add more or any suggestions, please comment, and please do share and subscribe for more content. Thank you.